This morning, the FDA is warning doctors and patients about counterfeit Botox. Dr. Stephen Hopping joins us this morning to explain. And the FDA just sent out an alert about fraudulent Botox. And what did it say?
Well, Keith, beware bogus Botox, because there's a new push from companies approaching doctors in the United States selling Botox is not approved by the FDA.
How do you as a patient, I mean, I know you as a doctor know, but how do you as a patient know that it's fake Botox?
Well, actually, it's really hard because you can't know. So you must ask your doctor, are you using Botox that's distributed in the United States and that has specifically FDA approval? These other Botoxes do not. We don't know if they're contaminated. We don't know how they're packaged. We don't know how they're diluted. We don't know how they're prepared. They're not safe.
Well, and we've all heard stories about Botox going bad. Doctor, should you get Botox in a doctor's office? Does it have to be done in a doctor's office? Is it legal to have it done someplace else?
Well, it is. It does have to be supervised by a doctor. But, you know, we all hear of Botox parties, and you can go to your spa, you can go to your dentist, you can get it. But we also, and we hear about these special deals. So these are the
deals on Groupon where you can get like 3 areas for like $300 and...
Exactly. So whenever you have this sort of situation, it's rife for the possibility of taking advantage of these less expensive illegal Botox methods.
But the bottom line is it remains very popular, I presume.
This is the #1 cosmetic procedure in the United States, in the world. So the potential for profit here is gigantic. So there's going to be adulteration. There's going to be bogus Botox. This is going to continue. The buyer has to be aware and has to ask the provider.
And obviously, some of the doctors want to capitalize unfairly, and some of the patients want to get cheap stuff. We all know that exists.
Well, you know, the cash counts, and unfortunately, you can't be too careful when it comes to Botox. We had a couple of patients who used adulterated Botox, ended up in the intensive care unit in Florida. 6 of them, all of them and nearly died. So it's this is a poison that has significant side effects.
So switching gears, there's a new device that gets FDA approval, and it could help tighten your skin.
Yeah, it's interesting. The FDA, when they bring out things that affect the cosmetic world, most recently there's a technique. We're all looking for things that are not surgery, and this is a technique that uses ultrasound energy. Yeah, there's some examples. Ultrasonic energy. These are good examples, of course. We only show good examples that help tighten the skin. Now, it doesn't work in everybody. It's not a facelift. They refer to it as an uplift. But for younger,
I can definitely see a difference.
You can see these are some younger patients. Again, it's not going to replace the facelift. But for people who don't want to have a facelift or are not ready for a facelift, ultratherapy is the newest, off the block, now approved by the FDA for treatment of the neck.
2 closing questions. You said
Yes.
those were younger patients.
Right.
Should age play a factor in this?
Sure. This kind of therapy is not going to give significant results to older age patients.
And lastly, how painful is this process?
Well, there is heat that is generated, so it does create some temporary discomfort. We use topical anesthesia for this. There's no anesthesia involved. There's no recovery involved, but it is sort of a little uncomfortable, Keith, to be frank. And some people will take a Valium or something to get through it.
Dr. Stephen Hopping with some of the latest innovations in the world of plastic surgery. Thank you so much.
My pleasure, Keith.
The time now, 11:41 right here on News 4 Midday. A D.C. school is about to get some very good news. Coming up, the big money prize that goes along with that good news. Plus, we have the